Hello, and welcome to Talk HLC 202 at AWS reInvent, making healthcare more personal with MetroPlus Health. We appreciate you joining us, and we're excited to tell you about a unique project where organizations across the healthcare spectrum came together to rapidly respond to the COVID-19 crisis in New York City. My name is Eric Zimmerman, and I'm a business development and product manager here at AWS. And I am joined by two esteemed friends and colleagues today, Dr. Amanda Parsons, the Deputy Chief Medical Officer at MetroPlus Health, and Praveen Modi, Senior Consultant, Conversational AI at AWS. Today, Amanda, Praveen, and I will cover the unique industry challenges posed by the COVID-19 outbreak in New York City, the solution we co-developed with MetroPlus, the real-world results and patient impact we saw with the project, and finally, the technical blueprint of how the solution was built. Our story starts in March 2020, as the COVID-19 outbreak was emerging as a crisis in New York City and really the country at large. The New York City Rapid Response Coalition came together in a matter of days. Organizations spanning payers and providers and social services, alternative care providers, delivery, technology, legal, financial, all joined forces in a humanitarian effort to prioritize the education and support of the most vulnerable populations in New York City. With this shared mission and philosophy in mind, the New York City Rapid Response Coalition set up calls just about every day of the week to work to identify key gaps, develop operational plans to address these gaps, and then to execute on the plans to help the citizens of New York City. The coalition ultimately decided on prioritizing three main projects. The first project was around food. The coalition delivered almost 200,000 meals to residencies across 4 New York City boroughs, focusing on areas hardest hit by COVID-19. The second project was around PPE. The coalition procured over 8 metric tons of PPE and delivered more than 60,000 surgical masks, almost 30,000 KN95 masks, and 10,000 face shields to frontline community organizations and workers. And finally, the SMS Outreach Project. The coalition sought to contact at-risk and vulnerable New Yorkers via text message or SMS, and offered channels for clinical and social services support. This is the project we're going to dive deep on today. Now, in order to execute in these areas, we needed to work with a payer provider with access to target populations, an established channel of care delivery, and maybe most importantly, a group that had truly earned trust with their members in the community at large. With that, I have the pleasure of turning things over to Dr. Amanda Parsons, who will talk more about the project scope, the iteration process, the product rollout, and finally, the patient impact.
Thank you so much, Eric. So first, let me tell you a little bit about MetroPlus, the health plan that I work for. So we are a wholly owned subsidiary of New York City Health and Hospitals Corporation, which is the nation's largest public hospital system. And we offer many different lines of businesses to our over 580,000 beneficiaries, including Medicare, Medicaid, managed long-term care. But importantly, we're just at about 72% Medicaid right now. So what does that mean? It means that our beneficiaries, on the whole, are sicker and have fewer resources. They have higher levels of chronic disease burden, and they also are afflicted with higher degrees of social stressors, which means that it's harder for them to be resilient in the face of stress or of shocks to the system, particularly during a pandemic. So COVID-19, we're now in March of 2020. New York State is the epicenter of COVID. And many of you who watch the news would see the hospitals that were inundated with cases of COVID. And for the most part, those hospital images that you were seeing were of our parent company, the New York City Health and Hospitals Corporation. Many of our MetroPlus members we knew were particularly vulnerable for all the reasons I mentioned before, including they live in overcrowded situations where the virus could be transmitted more easily, much more likely to feel the pain of things like food shortages and others. And we needed a way to understand how could we help our members who had high degrees of risk for this particular virus. And so we ran an analysis and identified about 85,000 people and thought, wow, that's a lot of people to reach out to by phone. That would have taken us about 4.6 years if we had put a single staff member on that. It was about just under 12,000 man hours. And so we were so grateful and so lucky when we heard about the New York City Rapid Response Coalition and their desire to work collaboratively with us to help figure out a way to solve this problem. So with pro bono project management support from Bain & Company, the tech expertise of the AWS team, and social service assistance from Air NYC, we were able to build a very, very innovative and important solution to reach out to our beneficiaries. And I'll be telling you about that today. So the first, I told you we identified 85,000 people. Who were these 85,000 people? Well, they were those people who we could understand, at least from the early data on COVID, would be at high likelihood of faring poorly if they got COVID. It wasn't necessarily those that were at risk of getting COVID. It was those who had the underlying respiratory conditions and the underlying cardiovascular conditions that could lead to poor COVID-related outcomes, meaning they would be more likely to need a ventilator and potentially more likely to die. So we knew that we had identified at least a high-risk cohort. But what we didn't know was what were their needs? What were they struggling with? At the time, we knew that those needs could be incredibly variable. People were concerned about losing their jobs, where people were running out of toilet paper, out of diapers, finding it hard to get foods, particularly in areas that aren't serviced by large grocery stores and instead are serviced by small bodegas that cannot possibly replete their stock as quickly as needed. We also knew that there were a lot of resources that were being put together, like different hotlines and services, food distribution channels, and we wanted to understand how to connect our members to those services if they needed them. And importantly, we wanted to monitor outcomes. How was this working? Were we at MetroPlus, when working on this project, flooding or straining any of these resources that were being put up to assist? And so it really required a comprehensive solution. So the first phase of the design was really thinking through what could we do. We knew we didn't want to just send out a text message that said, hope you're okay, stay safe, we're thinking about you, or if you have symptoms, go to the emergency room. We knew it needed to be far more sophisticated than that. So first we started to understand, okay, people who are struggling with COVID-related issues, what specifically are they struggling with? And we understood that they could be at least twofold. First was, did they have COVID? And where should they go if they thought they had COVID? And so we wanted to connect those people to the New York City COVID hotline, which was being manned at the time by physicians and nurses who could provide sound medical guidance and advice to people about where they should go for care. The other aspect of COVID, we knew it was causing extreme amounts of stress and anxiety, particularly around frontline staff who might find themselves in a position where they didn't have sufficient PPE, or concerned about whether or not they should go to their job, concerned about a host of other things. The New York State Emotional Wellness Hotline was staffed by therapists and available free of charge for people to call to talk about their stress and anxiety. So we figured we would connect people to that service. We also knew that there were going to be a lot of healthcare access challenges. This was right at the time that a lot of doctors' offices were starting to close. And people might have been, at the tail end of having their medications and in need of a refill. They might have needed to talk to their doctor and their doctor's office was closed.
And so we decided to ask people, do you have enough medications? If not, do you want to be connected to somebody who can help? And that would have been our MetroPlus pharmacy team that could have given them more refills. In terms of a doctor, we couldn't obviously open up doctors' offices that were closed, but we did have a new virtual visit platform, telehealth platform, that our beneficiaries could have called to talk to a doctor, talk to a therapist, whether it be for a medical issue or a behavioral health issue. We wanted to make sure that our beneficiaries knew about that new service. And then we also wanted to make sure that we were screening for people who were having difficulty accessing enough food, or who were finding themselves newly unemployed and unsure of where to go to get unemployment assistance. And we were lucky to be paired with a wonderful community-based organization called AIR NYC, who provided the community health worker support to assist our beneficiaries. They did that for the first 3 weeks, and eventually our own care managers took that function over. And lastly, we thought, we probably didn't think of all the different needs that people might have. And so we offered this other bucket that said, just like, if you need anything else from us, if we can help you in any other way, please let us know. And we decided to connect those people to our customer service line. And there were other things that we had to consider together as a team. Was it better to try to reach all 85,000 of those people quickly, or should we take a smaller subset and reach out to those people more frequently? And in the end, we decided to go more wide than deep, meaning that we would try to reach as many people as possible at least once, instead of taking a smaller cohort and reaching out to them more frequently. So we spent some time designing this script, and it was in a heavily curated, heavily iterated script. It's amazing when you think about how to really compress these complicated questions into a couple lines, into essentially a text equivalent of a tweet, right? Just to capture people's attention. The other thing is, you're not used to getting a message from your health plan. And so we were worried that people would think it was a scam, or that they wouldn't understand who we were and what we were trying to do. And so all of the wording in our script was very carefully curated to say, does this quickly and effectively capture the spirit of what we're talking about? But it wasn't just the words that mattered. It was the order in which you presented them. We could see from our iterative design and deployment process that if you worded the script one way, it would lead to a certain engagement rate. But then if you change the wording, you could get more people to engage with the chatbot. And so that was a lot of what went into the work. And ultimately, what we ended up launching was a chatbot solution that allowed us to screen for the things that I talked to you about and connect people to care and ask them, do you have this issue? And if yes, do you want to be connected to care? Many people don't necessarily want to go that next step. And so we made sure that we offered them the choice. And importantly, the chatbot had a couple of features that made it very user-friendly. For those who didn't want to engage with the message right away, we did let them know that they could just wake up the chatbot again just by replying hi. And many people did do that over the course of the campaign. They would wait till when they had an issue, and we were surprised actually to see just how many people engaged with the chatbot after hours for the help that they needed. And some of the other design elements were that we offered multiple languages. Again, our beneficiaries really represent a very rich and diverse cultural background. And so it was important not to just content ourselves with the English version of this script. So in the first 3 weeks of deployment, we were able to reach 54,000 of the high-risk New Yorkers. They received a text message, and about 9% of them engaged with the chatbot. Over half of those reported that they had at least one health or social need that they reported, and more than half of those were connected to or asked to be connected to a resource or a service to help them. So in terms of the launch summary, if you if you want to understand it in a little bit more detail, the way the numbers work is about, like I said, about 54,000 people got the text, and then 9% of those engaged. So that's about 5,000. And of those that engaged, 55% said that they had a need. So that was about 2,700 people who reported having at least one need. Importantly, of the people who reported a need, 95% of them reported issues with a social service issue. So that was related to food or unemployment assistance. The next most common need was around COVID related issues. COVID, whether they fear that they had symptoms or wanted to talk to somebody or get connected to that emotional wellness line that I spoke to you about, or get connected to that telehealth solution. Next was this broad bucket of other that we had offered, and so they were connected to our, like I said, our customer service. And then the pharmacy refills was the least common, but still an important need, coming in at 9% of all the needs. And then we also tracked the connectivity, which fell much along the same percentages that I just mentioned. But that's the numbers, right? That's and that is what we looked at every day. But what I really, really want to convey to you is how important this mattered to people, to the people who received this text message. And I wasn't even, I couldn't, I hoped that what we were doing was making a difference. It was so gratifying to hear on the other end from the beneficiaries who said, I really appreciated you reaching out. I was so down and out. I had lost hope. I saw that text from you guys and it reminded me that somebody cares, and I was able to reach out and get the help I need. That was one of the comments that we got back from one of our beneficiaries, Lenora, who was a domestic abuse survivor who was living at the time of COVID in a homeless shelter with her two sons. Another, Servia, who was a woman who was pregnant with her first baby. She was an Uber driver, and she had just quit her job because she was so worried about the health and well-being of her child, was finding herself in a position unable to secure all the food that she needed for herself, but as well as the baby supplies she needed for the baby. And she was very, very pleased to get our text, and we were able to help connect her to the resources she needed. And these are but two of the many, many stories that we got to hear from our beneficiaries. And it really made a huge difference in the lives of people. And importantly, it did so quickly during an incredibly difficult time with a technology that was so agile and quickly developed. And it was just wonderful to work with this team. And I will turn it over to Praveen, who'll tell you more about the technical details of how it all came together.
Thank you, Amanda, for a great overview and your continued partnership. When we started building this solution, we had some key objectives in front of us. MetroPlus wanted to reach out to tens of thousands of people in need. It was important for us to develop a scalable solution which allows a large number of users to engage with the bot simultaneously. Second, solutions should provide support for multiple languages. MetroPlus needed English and Spanish, but we wanted to ensure that we add more languages without a lot of additional work. Since launch, we have already extended this to some additional languages. MetroPlus chatbot experience allows users to connect to different helpline numbers like medical provider, pharmacy, and unemployment support. We wanted to provide a seamless mechanism to connect the customer with the right call center without having them to dial a phone number. And finally, because of the iterative nature of this campaign, it was important that the business users can update the content quickly without the help of IT. So let's look into the solution. So since the pandemic was in full swing, we wanted to build a solution very quickly. We didn't have a luxury to develop a GUI interface or integrate it with a CMS to manage content like questions and responses and even the business logic. However, we do wanted to provide a flexible solution which allows MetroPlus team to launch and iterate on these campaigns very quickly. So after some brainstorming, we decided to use CSV, or a comma separated file, to manage the content and the flow. We leverage the UTF support in CSV files to add non-English languages like Spanish. So using CSVs basically allowed us to add any languages which supports UTF-8 character set. Since launch, we have tested the solution with 7 additional languages, even some complex ones like Mandarin, Bengali, Arabic, etc., which kind of makes it a great solution to reach the diverse population. However, a word of caution, you need to be very careful when using special characters, as some text editors may not interpret them correctly. Using CSV also made it easy for the business users to add and update questions and even make changes to the flow. Let's look into some of the AWS services we leverage to create this highly scalable and flexible solution within a matter of days. So starting with Amazon Pinpoint, Amazon Pinpoint allows you to connect with customers over channels like email, SMS, push notifications on mobile, and even voice. We leveraged Amazon Pinpoint to launch our SMS campaigns. Amazon Lex, the heart of this solution is Amazon Lex. Amazon Lex is a service to build conversational interfaces using voice and text. The NLU capabilities of Lex allows us to create lifelike conversational experience for the MetroPlus customers. Amazon Connect, it's an easy-to-use contact center service. We used Amazon Connect to connect the users with the right call center without having them to dial the phone number. Amazon DynamoDB, a very popular database service. We used Amazon DynamoDB to store user responses, which also kind of helped us build analytics later on so that we can see the performance of the bot and how people are responding. Amazon Lambda, a popular serverless service. We used Amazon Lambda to host business logic for our solution. And then we also used a couple of other services like Amazon S3, where we upload the CSV file, Amazon CloudWatch, where we are looking into logging, and if we get into errors, that's where we are going to do debugging. So let's look into the architecture of it. So here's the high-level architecture of the solution we have built. Let's start to go from the far right. This flow shows how business users can update the bot content. So once the business user is done updating the questions, they upload the CSV file to an S3 bucket. When the file gets uploaded, it triggers the S3 event, which executes the Lambda function. Now, this Lambda function contains the code to parse the CSV file and write the data to a DynamoDB table. Our bot reads all these questions and content from this DynamoDB table. So if you look at it, the process for the business users is pretty simple. They update the CSV file, they upload it to a S3 bucket, and from the S3 bucket, the content gets injected into the DynamoDB database. So let's move to a little bit left and look at the flow when the user interacts with the bot. So starting with Amazon Pinpoint, Pinpoint acts as an interface for all the communication with the end user. We use Amazon Pinpoint to send out the outgoing text messages. When the user receives the message on their mobile phone, they can start to engage with the bot by just responding to that message. When the Pinpoint back receives the message back from the user, you would notice that there's an SNS notification. So it triggers the SNS notification, which again, in turn, executes the Lambda function. Lambda function reads the user's message and passes the text to Amazon Lex for processing. So if you notice, Amazon Lex is communicating with Lambda, as well as it is also communicating with the DynamoDB. So once the message is being passed by the Lambda function and passed it on to Lex, using the NLU capabilities, Lex matches it to the correct intent. It's trying to figure out what the user is trying to respond with, what the user is trying to say. However, to fulfill the intent, Lex will need to call a Lambda function because that's where the business logic resides, right? So how should we respond to this message? So Lex will call the Lambda function. Every Lambda function will have an intent handler which handles that particular intent. That intent handler is going to execute the business logic, as well as it's going to interact with the DynamoDB database to store the response received from the user, but as well as pull the next question out of the DynamoDB database so that it can be sent back to the user. Now, if the response is more around connecting the user to one of the helpline numbers, then Lex will connect to the Amazon Connect APIs and create a two-way call connect. This is very important because, as you see in the bot, there is multiple phone numbers, there's multiple call centers to connect to, and which can be a little bit confusing to the end user. Having this capability to connect the user seamlessly without any manual intervention from their end makes it super easy for them to connect to the right call center. And since we launched this feature, we have seen a significant jump on where people wanted to talk to somebody at the call center. So let's look into some of the resources. So we continue to publish some great solutions and information on our AWS blog. After building the solution for MetroPlus and AWS agreed to share the solution with the wider community. So we published a detailed blog post demonstrating the MetroPlus solution and the sample code. This blog post provides a step-by-step guide on how you can deploy this solution for your organization. It also comes with a CloudFormation template, which makes it super easy to deploy, because once you deploy the CloudFormation template, it will provision all the resources required for this particular solution. Say if you want to build a solution which is similar to this, but instead of using the SMS, if you want to use that the user can call a toll-free number, there is a blog post on our Amazon blog which shows how you can build Amazon Connect-based triage bots. There is a lot of great information on AWS blog, which you will find useful. You can reach out to your AWS account manager to see how we can collaborate together to deploy similar solutions for your organization. One of the most fulfilling part of my job at AWS is that I get to work on initiatives which are real and positive impact in society. As a part of the response to COVID-19, Amazon and AWS worked on several initiatives. And it was a huge moment for me to see that Amazon CEO picked our work with Rapid Response Coalition and MetroPlus to highlight in his letter to the shareholders. As you see, there are several healthcare sessions being offered. Topics from healthcare executive outlook to fireworks on AWS to using AI to automate clinical workflows, just to name a few. Please take some time to review all of our other sessions and join those that are of interest to you. On the behalf of AWS team, Eric and I would like to thank Amanda for joining us today to share how MetroPlus and NYC Rapid Response Coalition work together to help people in need. Please visit metroplus.org for more information about MetroPlus or aws.amazon.com/health if you have questions about AWS services and solutions in healthcare space. Thanks for joining us today. We hope to see you at the next session. But before you go, it's very important for us to get your feedback. So we would truly appreciate if you can complete a short survey after the session. Thank you.